Ayubowan. I'd like to introduce myself. My name is Venerable Nissarano, and I'm an Australian monk who's lived in Sri Lanka for almost 14 years. And for 8 of those years, I lived in a cave, an ancient cave, near Balangoda, about 30 kilometres from Balangoda. And I ordained 22 years ago with Ajahn Mahatero. You've probably heard of him as he visits Sri Lanka quite often. And this is a short talk for doctors and for nurses and for medical support staff, and particularly those who are looking after the quarantine centres and caring for the COVID-19 positive cases in Sri Lanka. I've heard from a friend that you are doing a fantastic job. So, Anumodana, Anumodana, Anumodana. And this means, if you don't know the Pali, this means rejoicing. Rejoicing for the services you are offering to all the sick, especially those with COVID-19. I think in Sinhala we say Ashirvada, Ashirvada, Ashirvada. In the United Kingdom, in Britain, people came out of their homes and clapped for the National Health Service. And so this is something of like a clap or an ovation for you. And many cities throughout the world had lights on their major buildings, their large buildings, as a thank you. And so this is really a very big part of this message is the debt of gratitude that the country owes you. And the Buddha described gratitude, katanyuta we call it, as one of the highest blessings in the Mangala Sutta, in the sense of being thankful, feeling we've been blessed, but we're so lucky, and we're appreciating things. And we appreciate very much the sacrifice that you are performing, the risks you are taking as frontline workers for this war, as it were, almost on COVID-19. Because the doctors, the nurses, and the medical support staff, aren't you, are, in a sense, risking your lives. And many doctors, nurses, support staff in other countries have died from COVID-19. So this is, of course, something very heroic to give one's life for others. And also sometimes doctors and nurses and medical staff other medical support staff have to isolate themselves from their families. So that's an extra sacrifice that you're making. And I'd like to emphasize, please do not be disappointed if people aren't grateful, because sometimes people are stressed or desperate. And the Buddha said there are 2 rare people in the world, a grateful person and a person who does something without being asked. And I'd like to bring up a story about how the Buddha approached dealing with the sick. When on one occasion, he and Venerable Ananda were walking around a monastery, and they saw a monk who was lying in his own urine and feces. He had dysentery. And the Buddha and Venerable Ananda took some water and washed that monk and then lifted him up onto the bed. He'd evidently fallen off the bed. And the Buddha said to the other monks, he said to the monks when he addressed them afterwards, the one who looks after the sick is looking after the Buddha. And for those from other religions, when you are looking after a sick person, it's like an offering to God. So we can think of this work as being a way of honouring the Buddha, a way of honouring God, perhaps. So, and we can use, I would like to encourage you to use your service, what you're doing for others, to develop your spiritual life, to develop this inner happiness. And we can think of there are many people who have done this. We think of Mother Teresa in Calcutta. And we can develop more compassion. I'm sure you've all seen plenty of difficult situations and recognize the suffering and the pain of your patients. and we can develop empathy. But of course, it's good to avoid taking on their sufferings. As one teacher, Ayakima, used to say, feeling that compassion is feeling with, not suffering with. Because if, as she said then, that if there is suffering with, then there are two people suffering. This is called double dukkha. So, and also we can't be so effective. And it reminded me of a story that my teacher, Venerable Ajahn Brahmavamsa Mahatero, has told of a young intern, a doctor, and on one occasion, early in his career, he was very distressed because a young mother that he was looking after had died. And he was really, really distressed by this. And he approached Ajahn Brahmavamsa Mahatero because he'd known him since he was a boy, because he'd attended the Dharmpasala. And Ajahn Brahmavamsa gave him some very good advice that I'm sure you'd all appreciate, which is, one can't always cure, but one can always care. Isn't that lovely? One can't always cure, but one can always care. And also when you think of your work, you can think of it as a gift to the patients. And when we think of giving a gift, it usually brings happiness to us, a sense of joy, a sense of purpose too, and meaning in our life. So that it's not just a job for you. It's not just something you have to do. It's a gift you're giving to these people who are in very difficult situations. Not only the COVID-19 positive people or those that are in ICU, and others as well. And when you give, as Jesus said, you shall receive. So what do you receive? Happiness, satisfaction, a sense of purpose and helping others. And very much your work is about developing goodness, this power of goodness through a very good intention. We say this is a very strong form of good karma, we call it. And it depends, of course, on having a good heart, which is free of desire, free of negativity and free of delusion. And in Australia they have a saying, and I think this relates very much to karma, what goes around comes around. So it's like a boomerang, so you can expect all this goodness to come back to you. And I'd like to summarize this short talk to you with a lovely story that my teacher Ajahn Brahmavamsa often uses, and it really captures the situation, not only for yourselves, but for all of us, really. And in this story, it's the story of the emperor's 3 questions. The emperor was asking these 3 questions. He asked so many people their answer. And those 3 questions are, what's the most important time? Who is the most important person? And what's the most important thing to do? And he asked lots of people, offering a vast prize for it. But eventually a simple hermit living on a mountain answered those 3 questions for him. And he said, what's the most important time? And the hermit said to him, now is the most important time. We have to remember now is all we have, really. And who is the most important person? And the most important person, according to the hermit, is whoever we are with, or ourselves when we're alone. Ourselves when we're alone. And what's the most important thing to do? To care. So this really brings it all together. So now I'd like to give a short blessing for you, for your work, and as a sign of thanks, of gratitude, not only from myself, but from Sri Lanka. May you abide in well-being, in freedom from affliction, in freedom from hostility, in freedom from ill will, in freedom from anxiety, and may you maintain well-being yourselves. May you abide in well-being, in freedom from affliction, in freedom from hostility, in freedom from ill will, in freedom from anxiety, and may you maintain well-being in yourselves. May you abide in well-being, in freedom from affliction, in freedom from hostility, in freedom from ill will, in freedom from anxiety, and may you maintain well-being in yourselves. Anumodana or Ashirvada. Sadhu, 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 sadhu.